Why are you fasting that way? That's a question I asked my patient today. So, for context, my patient has hirsutism, and we had discussed the importance of her losing weight. So, whenever she comes in for her follow ups, I always try to find out what she's doing to help with her weight loss. And so, she told me that she was doing intermittent fasting, specifically ADF, alternate day fasting. And I was like, how's it going? And she was like, it's not that great. I'm super tired. I don't know if I can do this, blah, blah, blah. So I'm like, what exactly are you doing? And so she tells me that she fasts for one day. And then on the next day, she eats like very minimal calories, like less than 1,200 calories. And I was like, why are you fasting that way? Like, that's not how you're supposed to do it. So here's my tip for all of you intermittent fasting warriors out there who want to do something like ADF. On the days when you're not fasting, you need to eat well. And you need to prioritize protein. You need to prioritize healthy fats. And yes, you need to prioritize carbs as well. Because when you're doing alternate day fasting, like you're going 24 to 36 hours without any food. So you're not eating a lot of calories. Like think of it as one day you're supposed to expend about 3,500 calories, right? So you need to eat really well on the days when you're eating so that you can actually go through a fast, 36-hour fast comfortably. So a protocol that I usually recommend for people is like you can do 3 days of intermittent fasting with ADF. So maybe Monday, Wednesday, Friday, and then Tuesday, Thursday, Friday, Saturday, Sunday, you just eat regularly. So you eat 3 meals. Make sure you have at least 30 to 40 grams of protein in those meals. Eat your healthy fats, eat your carbs, things like that. And if you need help trying to figure out all of that, then I have something coming up that I'm going to be doing. I'm going to be doing basically a weight loss course or a fat loss course or intermittent fasting course. I don't know what I'm going to call it because she was like, well, can you help me? Can you give me more information? Like, I would love to just follow a plan. And so I was like, all right, fine, I'll create a plan for you. But in case you're interested, then I'll put some information in my bio for people who are interested in a fat loss course. This is specifically for people who need to lose at least 30 pounds, and it's going to be like a 12-week course. But anyway, back to the story. There are different types of intermittent fasting that you can do. So basically, you need to pick a plan that makes sense for you. I don't think that alternate day fasting is something that you can do long term. But if you want to do it to lose fat, like a significant amount of fat in a short period of time, then I would say alternate day fasting is okay till you get to your goal, and then you can go down to something like 2 meals a day, which is something that I like, or just 3 meals a day, just making sure that you're not snacking in between and that you're eating enough protein, weight training, all the things, taking supplements. So if you're interested in more, just let me know.